Great. Well, just thank you very much for taking some time out this morning. My name is Rick Joseph. I may have met with you last year with Ann. We are really excited about having an opportunity to talk to you about your Medicare options. As you may know, this is the start of what's referred to as the annual election period. You may have been receiving lots and lots of information at home in the mail. And one of the things, of course, that you are going to do is review your plan options, try and decide what may be possibly best for you as far as your health insurance coverage is concerned. So what we'd like to do, and what I'd like to help you with this morning, is just kind of clarify a few things. We're going to take a few minutes this morning and go over a very general overview of the Medicare program. Because Medicare in and of itself there are a number of different options that you have when you're enrolled in the Medicare program. You can use Medicare in its most original form. You can use Medicare Part A and B with an additional supplemental program if you choose to, or a Medigap policy. You can enroll in what's referred to as a Medicare Advantage plan. You also may have a prescription Part D drug program as well. And so just want to kind of make sure that everybody begins to understand what all of those things mean. There's lots of language that we're going to use. In addition to that, we're going to make sure that we help you understand what types of pointers to look for whenever you're reviewing a policy, and then helping you understand what may be your best option as well. Okay? And as we make sure that we end that, then we'll also make sure that we have questions and answers. You can make sure that we answer your questions for you as well.
好，我先打断一下，如果有人真的完全听不懂的话，我会当翻译。如果你们说大概听得懂的话，我就先让他把图片，我跟你讲，这个图片是一定要讲，好，不讲不行。所以有人需要翻译吗？如果不需要的话 ，OK， 哇 ，great。 Everybody understands, because I said, by law, we have to go through this.
You have good English.
Thank you.
By the way, we is from London, so that's why
English.
It's real English.
English.
I know him very long time. By the way, I just turned 50th birthday.
Thank you.
So you have a long way to go to get married.
I'm working on it. I'm working on it. I'm working on it. Well, great. That's good. That's good. Okay. So we're going to talk about a few things. We want to make sure that we understand how you become eligible for the Medicare program. Talk a little bit about the options that you have, when you can enroll, and also some next steps as well. So let's talk about Medicare. How many people are currently enrolled in the Medicare program, if you don't mind me asking? Okay, quite a few of you. When you become eligible for Medicare, most people, it's when you reach age 65. For some people, as time goes by, it may be a little older because they're changing the age requirement. But for most people, it's when you reach age 65. And that's when Social Security will send you some information, a card that looks kind of like this. And it means that you now are enrolled in the federal government's health insurance plan, which is called Medicare. Medicare. They always talk about a couple of things, Part A and Part B of Medicare, and sometimes people don't understand what that means. Part A just means that you are now enrolled to receive benefits for any hospital care. If you have surgery, if you go to the emergency room, if you have to have any long-term skilled care in a nursing facility, that's covered under the Part A portion of Medicare. Part B is the medical benefits, doctor's visits, lab services, x-rays, home health care. Having Part A and Part B means that you have a fully integrated health insurance plan. And that then will offer you health benefits under the program. A lot of people sometimes think that Medicare is free. No, it's not. Medicare is not free. We pay for our Medicare coverage. The way that we pay for it is when we are working, they of course take money out of our check, right?
Yes.
Yeah, so your taxes pays for the largest portion of your Medicare coverage, especially the hospital part. Part B, you may have found that you're paying a monthly premium. Okay, if you're receiving a Social Security check, you may have noticed that there's some money missing. Yeah? About $100, $99.90, I believe. Okay? That's your premium that you pay to be enrolled in the Part B portion of Medicare. And one of the things that you then decide after that is how you're going to use your Medicare coverage, because the original Medicare program doesn't pay for everything. In its most original form, it only pays for 80% of your hospital benefits and your doctor's visits, and it leaves you with 20% that you have to now pay for. And so people try to find a way to make sure that they can cover that. And that's what we're going to talk about, how to do that. Can everybody see this? Yeah? So what this is just explaining is what I was talking about. Most people are always enrolled in the original Medicare program, okay? And that's the policy that allows you to receive coverage for up to 80% of your hospital visits and your doctor's services and those types of things. Thank you very much. Wow, I feel like a teacher. Thank you. So, there you go. Thank you very much. That's great. So, one of the things that you can do, of course, is to buy what's called a supplemental plan. Has everybody heard of a supplemental plan? Yeah? A private policy. State Farm. AARP. Mutual of Omaha. Regents Blue Shield. These are all companies. There are about 32 companies in Washington State that you can use. The only thing that a supplemental plan can do is cover the 20% of your medical services, okay? Your hospital benefits and your doctor's visits. It doesn't pay or cover your prescription drugs. So if you were to buy a supplemental plan, you may also have to buy a prescription drug program, or Part D. Has everybody heard of Part D? Yeah? So if you want to make sure that you get help to pay for your prescription drugs, not only would you have to have a supplemental plan in addition to this program, but also you'd have to buy a separate prescription drug program, a Part D plan as well. Some people also choose to purchase what's called a Part C plan. You ever heard of Part C before? Yeah, what's also known as a Medicare Advantage plan. Have you ever heard that term before? Yeah, a Medicare Advantage plan. It's a private company that will manage and help pay for all of your benefits covered under the original Medicare program, and also combine all of the things included in a supplement and your prescription drugs. It's like having all of these things combined into one program. So companies like United Healthcare, or Group Health, or Regents Blue Shield, or Humana, there are a number of different companies. They all have a very special private contract to help manage the Medicare program. And if you decide to use one of those plans, then you carry their card and you receive all of your health care. You're still enrolled in the Medicare program, but a private company is going to help manage all of those things for you. We kind of talked a little bit about this earlier. I was explaining the difference between the Medicare program, and this kind of explains it as well. So your hospital benefits and your doctor's benefits. Can everybody kind of see this? Yeah? So this is just explaining, when you're enrolled in the original Medicare program, hospital is Part A that covers for your hospital and home health care. Your Part B that we pay your premium for, that includes coverage for your physician services and ambulance benefits. And that's when you, of course, are then using that to make sure you receive your coverage, but you're still responsible for a portion of it. The things to keep in mind about the Medicare program is that, you know, some people don't pay, most people don't pay a monthly premium for their hospital benefits because you've already paid that into the system. What you are going to pay for is the premium for Part B. And beyond that, then you are going to decide how much you're going to pay for your Medicare Advantage plan or your prescription Part D program based on the choices that you make with the companies that are available. All right, let's talk a little bit about supplemental plans. Sometimes when I explain or kind of talk about supplemental plans, people don't really understand what they are. And like I said, it's a private policy, separate private policy. The only thing it can do is pick up and pay for the 20% that you are responsible for under the original Medicare program. So the things that you have to remember is that with supplemental plans, they sometimes refer to them under these letters. If anyone was talking to you about their supplemental plan, they may say something to you like, I have a plan F, or I have a plan N. And you may say to yourself, what are you talking about, right? Well, it's just a way that they have decided to reference the programs. And the reason for that is because they all offer whatever policy you purchase, whether it's a plan A or a B or an F or an N, they all have exactly the same coverage regardless of which company you purchase that policy from. They're standardized throughout the entire country. So if you were to buy a supplemental plan F from State Farm or from Regents Blue Shield, for example, even though there may be a difference in the price, they can't offer you anything additional for that price. And so many times if people do have a supplemental plan, they may shop for the best price, if you will, or the least expensive price, because the programs are going to offer the same coverage regardless. Many supplemental plans do have some form of medical underwriting, meaning that you may be required to complete some kind of health screening. They're going to find out what kinds of health concerns you've had prior to issuing or offering you a policy. Sometimes when you first become eligible for Medicare, when you first reach 65, right, and I'm working on that, yeah? But when you first reach 65 and you first become eligible for Medicare, the first 6 months after your 65th birthday, when you begin to look at the types of programs that you may enroll in, if you decide to enroll in a supplemental plan, you do not have to medically qualify to enroll in a supplement within that first 6 months. But any time after that, if you decided that you wanted to, and there is an exception to that, but if you decided to, they may require you to fill out the health questionnaire that goes along with that. And there's a possibility that if you do have health concerns, they may not issue you a policy. So that's something to make sure that you kind of keep in mind about that.
What kind of condition it will be rejected, denied it, or accepted?
Good question. This gentleman was asking, what kinds of conditions are they looking for to either to possibly not issue you a policy? And many times it's forms of cancer, for example. It may be that you have had a stroke earlier. You have complications with your kidneys or your liver or something like that. A lot of times insurance companies are going to look at those issues and screen them out as a part of the reason for not issuing you a policy.
How about age increase?
Good question. The question is, what about if you are applying for a supplemental plan, is there an age requirement? With supplemental plans, when you first become eligible, there isn't an age requirement. Some companies may have a cost difference based on your age as well, but they can't necessarily screen you out specifically. It has to be across the board. It has to be for everyone within that certain age category as well. So if you decided to apply when you're 75 compared to 65, you may possibly have a different price, but it's because everybody who is at that age also has that same pricing as well.
I can add one, just easy way, because 那个 supplement 它有那个申请单，跟你那 Advantage 最大的不一样。Advantage 就很简单，他只问你一个有没有kidney failure， 如果有这个，其他你就算住在nursing home， 他都会收。Supplement 它不一样，你把它打开来，他会问你好多的问题，甚至问你有没有吃药。所以他这个你申请的那家公司，他就会做一个审核 underwriting。但是基本上，他从 A 到 Z 就这样子，就是你 F 就是刚刚会讲的是最 comprehensive。那通常他如果说你的条件很不好，他还是会 offer 一个，但是可能是 A 啦，或者比较
贵的。
No， 比较低 ，A 就是保险的 coverage 比较少 ，F 就是最完整的 ，OK。所以呢，那个申请单一打开你就看得到，他会问你很多很多的问题。
那会不会要求去几个检查？
不会，他会自己本公司做一个安排。
All right, so as we're moving along, one of the things to remember, supplemental plans, some of the reasons that people like supplemental plans is because you do not have to choose a specific doctor to work with. There aren't referrals necessary with that. They allow you to, you can use them virtually anywhere in the entire country. People feel they're very flexible with the way that they use them, and it gives them the opportunity to make sure that they can use them whenever they're traveling anywhere in the country. The things, of course, that a number of people may run into is that sometimes doctors may or may not be working directly with Medicare, with the federal government's Medicare program. And so you may find, even though you have Medicare and you also have a supplement, that you may have some out-of-pocket expenses that aren't covered either by your supplement or by the Medicare program. That's one of the things to kind of look at. The other thing we're going to kind of look at is what's the difference? So that's a supplemental plan. We're going to talk about Medicare Advantage plans, okay? And sometimes they refer to these as Part C. Why do they refer to it as Part C? You don't know. Does anybody know why they call it Part C? Okay.
It's combine all the the coverage.
Give him a prize. Part C. Why do they call it Part C? Okay, so we talked about Part A, right? Does anybody know what Part A of Medicare is? Hospital. You've got lots of prizes to do that. Hospital. This is good. Hospital is Part A, right? Okay, Part B is medical. That's right. Yeah. So now everybody wants a prize, right?
Wait, hold on the question.
Oh, yeah, I know.
Otherwise, I would.
Excellent. Okay, so hospital is Part A, medical is Part B, right? What is Part D?
Medicine.
Drugs. That's right. And that's the reason they call this Part C, because they skipped it. But Part C is a combination of A, B, and D.
Yes.
Right. So if we want to do an equation, yeah, C equals A, B, plus D. Exactly. And in many times, exactly, that's great. Includes your medical benefits, your hospital benefits, and your prescription drug program as well. Yeah? And that's what a Part C plan is. Now, whenever you're going to enroll, if you're looking at enrolling, or if you currently are using a plan like this, the eligibility requirements are that you are enrolled in Part A and Part B of the Medicare program, okay? That you live in the county that the program is being offered. So if we all live in King County, any of the companies that are offered in the King County area, you could enroll in. And there is one very specific medical requirement that would stop you from enrolling in an Advantage plan. And that is that you have been diagnosed with what they call end-stage renal disease. your kidneys have failed and you are receiving dialysis treatment. Does everybody know what that is? Mm-hmm. Yeah. Why is that, sir? Give him a prize anyway. So why is that? Well, it's because the federal government manage the dialysis program throughout the country. And if you are using that, you actually now are enrolled in the Medicare program, but it's separate from everybody else using an Advantage program. And that's the reason why. So as we say, you know, if you are enrolled in an Advantage plan, the things that you'll realize is that it includes all of your benefits of Part A, all the benefits of Part B, your prescription drug coverage, and the things that you'll find is that some of the programs add some additional benefits and services for you. Some of them may include a gym membership. Some of them may include a hearing aid benefit, vision coverage. You know, all of those things are not covered under the original Medicare program. But with some individuals, if you are looking at some of the Advantage programs, some of them may offer you coverage without your having to pay an additional monthly premium. Some of them have a premium. So the things that you have to make sure that you do is, you know, make sure that your doctors are working with the programs that you're looking at, you know, and then you also look at the types of medications covered under that program, and if there are additional benefits that you need to make sure are covered, that they are also offered under that program as well. And the nice thing is, of course, is that Anne has access to, I think, all of the programs that are available in the King County area. And so she'll be able to help guide you through those choices as well.
And the common illness.
Emergency and?
The common illness.
No more
Just a common illness.
Yeah.
Like having the flu. Yeah?
Or high fever for some reason.
Okay, no, that's great. The question is, how do you define, or what would you consider an emergency? You know, is there a definition for that? An emergency. A lot of times, if you are not feeling very well, you went skiing, okay? You've got a really bad sore throat, you wake up in the morning and you are in Issaquah, okay? If you're not feeling the definition of an urgent visit to the doctor is that you're not feeling very well and you are away from home. You want to make sure that everything's okay. A lot of times when they define an emergency, it's something life-threatening. But the thing about that is that if you aren't feeling very well and you're away from home, and the only place that's available is a hospital and an emergency, then you need to make sure you go and look after yourself, okay? So even though the definition of an emergency is something life-threatening, make sure that you go and see a doctor or use the emergency room if you've got a sore throat and you're away from home. It's considered an urgent visit, an urgent care visit. And that's covered under the Medicare, the Advantage programs as well.
我跟大家补充一下哈 ，urgent care 就是比如说我今天生病，我跟医生约10月18号，但是我突然半夜醒过来，有的时候你去 emergency， 只要一 touch emergency 就很贵。urgent care 有时候你不知道，你可以上电脑去 zip code 去查你的 plan。 它有的地方是24小时营业，它好像在这边也有一个。OK， 那个的话，通常比如说 Advantage 很多就是把它 bill 成40块，哦，今年的我是这样讲，所以就会比 emergency 便宜。所以有时候不要就说啊，我自己想说是 emergency 就赶快去 emergency。urgent care 其实是蛮好的一个 service， 因为这个它没有限制。那它到时候它会 bill 出去，就是 urgent care 的 copay 就会比 emergency 少，这是一个诀窍。那个医疗是那个医生的成本，不过你 urgent care 是临时嘛，对不对？也许陈医师知道 urgent care 跟那个medical 的 clinic 有什么 difference？ 因为我没有听过 urgent care。
医师在看而已啊，哦 ，urgent care 呢，基本上就是值班的医师。 是愿意去那边工作的，或者说现在比较多的是 MP， 哦，是护士可以看病的那一种在值班，哦， 所以他看的大概就是普通的小事情这些哦。那急诊室呢就很麻烦，它恰也是算时间的，非常贵哦。那你去也是 NGO 在看，他们第一线全部现在都大部分用这个，哦，所以尽量少用急诊室哦。Then I got a question is, if you go overseas, what is the justification of urgent or not urgent? And who's decide how much you're going to pay for it, reimburse? Right? If you go to hospital outside, they charge $10,000. When you come back, bring this bill. We have to pay first. Then, how is Advantage claim covered?
It's going to be based upon, the question is who makes the decision about how much is going to be paid for either an urgent care visit or a hospital benefit? And the answer to that is it's all going to be based upon the plan that you are enrolled in, okay? So, for example, some companies, if you use the hospital benefit may say that you are responsible for, $390 per day for your hospital stay, up to a set number of days. If you're in the hospital for 7 days, each day that you're in the hospital, you're responsible for that set amount of money, and then on the 8th day, then the company will pick up 100% of your expenses. Or if you use the a doctor urgently, you're not feeling very well, you go to see the doctor, you happen to be in Arkansas, why on earth someone will go there, I don't know, but Arkansas, right? Your urgent care visit may tell you, under your plan that you have, you're responsible for a $50 copayment. The thing that you always need to do first and foremost is go and seek some health care, okay? The second thing you need to do is contact your health plan. Contact your doctor's office. Let them know that you received some care so that they can make sure they coordinate that information. The way that the program works, it's always going to be based upon the company that you are working with, and it's structured that way. So it's not that they're going to suddenly receive the information back and say, I'm sorry, but we don't think that this is an emergency. If you don't feel very well and you go and seek some health care, if you are away from home, if it's at an emergency room, there's going to be a co-payment for that. If you're admitted to the hospital, then it becomes the hospital benefit. If it's because you've got a sore throat, like this gentleman was saying, it's considered an urgent care visit. But all of those things always travel with you wherever you travel in the entire world. And that's the way that the program works.
Now, what I mean is, if you stay in the hospital in Taiwan,
yes,
the daily charge may be only $50.
Okay.
Okay, right. But you say it's $390 here. So how do you decide how much the plan will pay or reimburse?
The plan, you need to make sure.
Yeah, suppose the doctor there decide to do an MRI, but the US doctor said, no, you don't need it. Then who's going to pay for it?
And this is an emergency, is that correct?
If you say emergency, it's here.
Okay, so this is a hypothetical question, right?
You either want to say, yes, go ahead to do an MRI, then we come back to the US and say, no, it's not necessary.
Okay, but this is a hypothetical question, right? Okay, how many people here schedule emergencies? Let me ask that question. Does anybody schedule an emergency?
No.
No, nobody does. If you go to an emergency room, then they are going to try and figure out what's wrong with you. That's the whole point of going to the emergency room. If you happen to be in Taiwan and there is an emergency, they're going to do the same things in the hospital there that they would do here in Bellevue. They're going to try and make sure they figure out what's wrong with you, because that's a part of the emergency service. The thing that you need to make sure that you do is, or someone else who may be with you, is contact your primary care physician or your agent or someone here to make sure that they know that you have been hospitalized and that there is some billing and some other information that's coming back so that they can coordinate those things for you. They can't sit down and kind of figure out, I'm sorry, but, doctor, what is your name, sir? He doesn't want to say. That's right. So, and that's what I'm saying. If you're traveling and they are not going to try and justify how to look after you. They are going to look after you, and then you just need to make sure that you coordinate that with your health plan here. So I guess the whole premise of this is if you're traveling, you need to make sure that you feel comfortable knowing that you've got coverage when you're traveling. Okay? They're not going to question you about what it is that you're doing. If you don't feel very well, you're not going to wait until the very last moment to try and look after yourself. Find some health care. Make sure that you contact someone back here so that they can get a copy of the bill and the information, and then they can coordinate everything for you. And that's the way that the programs work in general. The thing that's different, of course, is that, just like this gentleman was saying, if you're using the original Medicare program, you are now responsible for almost 100% of the cost of your bills if you're outside of the United States. Medicare Advantage plans coordinate those types of things for you, and it's covered under the plan. You know, just for the sake of time, we're going to kind of go through some of this. It was a good question, though, and thank you very much.
Question.
Yes.
You defined earlier plan C is A plus B plus D.
Yes.
Right?
Yes.
What if a person enrolled in A, B, and D, then they don't need to sign up for C?
No.
So then what?
What's the catch?
Yeah, then why people need a C?
Okay. You know what? It's a
D actually, if you just say you sign up, D means you still have to pay something, the prescription, right? So now, Rick is trying to tell you an advantage. Sometimes the cost is zero. What's the catch? Yes.
Let me explain this. C is managed care. So that means the government put those money into this company. They have to save money. So they have to watch what kind of care you get, right? If you have a regular A, B, D, you can decide what you want to do, but you have to pay.
You still have to pay.
But C means government say, okay, those group of people, I give it to this company. We don't need to pay, but all those limit resources, they manage. So that's why my big question is, if you decide to do MRI, the managed care said no, because it's not necessary. But you say, no, yes, I need that. My brain is burning, right? I need something there, right? And managed care said no. One of the doctor in somewhere, I don't know, in the United States, said, no, he's a medical director, right? We have to call them, discuss with them, this is really, really necessary. Then he or she will decide yes or no, okay? So that's a managed care. But it's nothing wrong, because you want to save money, you don't want to pay. So you have to accept this condition, okay? This
So the C needs to be approved. All of the cases need to be approved,
sometimes.
right?
Sometimes.
So the quality is not good, like
Are you paying that?
So if I can just make sure that I gain control over my meeting again, right? I'm going to talk to you a little bit about some things, okay? This lady asked a great question, and she said, wait a second, if there's A and B and D, why do I need C, okay? It's a choice. And that's the thing that sometimes becomes confusing. Some people just want original Medicare, Part A and Part B, just by itself. They can then, if they want to make sure they have help for their prescription drugs, enroll in a Part D plan separately. But just like Dr. Chen said, you're right, you'd have to pay for your separate prescription drug program. And also, if you do use your Medicare plan, you also then have to pay the 20% that Medicare doesn't pay. If you enroll in one of the Medicare Advantage plans, the way that these companies work is that they are paid by the federal government. For everybody who enrolls in one of these programs, the federal government will pay upwards of about $700 per month per person to that company, and that company then is responsible for helping coordinate all of your benefits and services. And many times they find a way to include your prescription Part D program so that you don't have to pay an additional amount for it. The thing that also goes along with that is there are different forms of Medicare Advantage plans. So I know that we just had an explanation about a managed care, or what they refer to as an HMO plan, a health maintenance organization. Have you ever heard of that before? Yeah. So managed care programs mean that you have to choose a primary care physician. You know, you may be seeing a doctor with a Swedish physicians group. And in turn, that primary care doctor is going to be responsible for looking after all of your routine care, but they also have to be responsible for making your recommendations and your referrals for any specialty care. Having, you know, a scan or going to see a urologist or whatever that is. It's a choice. Sometimes people may be seeing all of the doctors at or with an organization, so they may feel comfortable with that. But sometimes people say to themselves, I don't want to do that, but I kind of like managed care programs and Medicare programs, so how about is there anything else available? Yes, there is. There are sometimes companies that come in this form. It's called a preferred provider, a PPO. What is that? It means that you have a Medicare Part C plan, but you don't need referrals if you are enrolled and using this type of plan. There are two companies that offer PPO plans, Regence Blue Shield
Like this.
and Humana, right? And if you use one of those programs, then you do not have to have a primary care physician. And as long as you use the doctors that are a part of the network, and these companies have very large networks of doctors, then you can pick and choose which doctor you see, and it's scheduled so that you have co-payments for your office visits, prescription drugs, hospital benefits. Many of them include things like vision and dental coverage, you know, gym membership, all of those things. And of course, there may also be an additional premium that you pay to enroll in that program as well. There are some programs that help people coordinate not only their Medicare coverage, but if you financially qualify for state assistance through Medicaid, then that's called a special needs plan. And sometimes individuals qualify for those, and they are also available as well. There are some programs that they call private fee-for-service plans. They're special plans that allow you to see virtually any doctor that you wish, okay? The way that the private fee-for-service plans work is that you have to make sure that the doctor knows you have a private fee-for-service contract, and they must agree to accept the fee that the company is going to use. And if they don't, then you may find yourself responsible for the additional monies that go along with that. Medical savings accounts are not available in Washington State, but they are one of the forms of Advantage programs that allow you to have a special policy and also put money into a separate account. And sometimes we may have used those when we were employed. I know that they started using them in some other states, but they decided not to offer them here in Washington State.
You mean the United Healthcare?
No, I'm talking about medical savings accounts.
But we have it in the regions of Blue Cross.
Not in Medicare.
You may have that as an individual, but not under the Medicare program.
Through Primera.
Through Primera Blue Cross? Through Primera Blue Cross is...
这里大家听得懂吗？这里。
I'm sorry, sir. Through Primera Blue Cross with what? Okay, are you eligible for Medicare?
No, I'm not that old yet.
I understand. and that's just it. We're talking about Medicare. Yeah, so that's kind of confusing. So the thing is, if you are not eligible for the Medicare program, you can have a health savings account and or a medical savings account. But today we're talking about Medicare. And that's the reason that I want to make sure that I help you understand how that works.
在华盛顿州，它的这个 health savings account 不 available， 咱讲的这样不是 individual，
现在在讲是整个 HMO、PPO， 这个大家了解吗？
没有不了解的话，我等一下，因为我们现在刚刚讲过，这个 slide 让它过去之后，这个就是
因为这里你没有讲清楚。
Completely separate.
再清楚一下。刚才提到的 Advantage 跟那个一般没有 Advantage plan 是 A、B、C， 你自己去买，对，你自己去买，你要付那20%的这个 copay。那在 Advantage 你说 managing all Medicare before you A B and D， 你还付不付那20%吗？
不付。他等于就是我这样讲哈，因为有的东西太复杂，常常我就跟我的 client 讲，就说最简单，你那个 supplement 的时候，就是 A 跟就是那个买那个 Medicare 不够的，所以你去看医生的时候，你第一张先拿你的 Medicare， 他会要你的 Medicare 卡。第二张就是看你哪一家 region 也有做 ，United 也有做，看你是买哪一个。那你们 Advantage 的话，千万不能拿你的 Medicare， 因为你已经把你的所有的都给了这一步，所以他刚刚 Rick 在跟你们讲，就是 Federal 已经把这一份的钱就交给，比如说 United Health 也有，刚刚这个女士她问我说，我现在有 A 有 B 有 D， 那我是不是还要再去花钱买 C？ 通常其实好。这里写 zero 就是说，2013年的时候 ，United Health 它还是会 offer Advantage Plan 不要钱，所以你甚至根本就不用去买药。你如果要参加 Apply Part B， 一定要加那个 Part B 的钱。所以他现在就是我刚刚不是一直跟你们强调，好像在吃西餐吗？就是整个 combine 起来。所以这个就是 typical 的 Advantage Plan。但是 Rick 刚刚 ，Can you flip back to the previous page？刚刚他说这个就是我们讲的 HMO， 那陈医师也有讲说 Advantage 有时候好像就是什么都是要经过你的家庭医生主宰，对不对？所以呢，你的弹性就比较不好。但是呢，有的人他愿意去接受，这个就是像 Group Health 它也是 HMO， 所以这个是个人的一个决定，对不对？所以呢，那这一家就是他刚刚讲 PPO 的 plan， 就是说。他现在还是在 under 在 Advantage， 不要忘掉哦，你还是要拿这个卡哦，你不能拿 Medicare 卡。但是现在他只要在他的医生的网路，你今天如果我说，我皮肤痒，我要去看皮肤科，我就直接可以在他的 Preferred Networking 去找，我不需要经过我家庭医生主宰。那 Medicare Is Not 呢，就是因为补那个所以它是基本上。他是还要再买个 prescription combine 起来。那有的人 prefer 那样子是，很多人他走到那里的时候，他会去买一个最好的 F plan， 所以你基本上很多都没有账单。你知道很多人他老了，他就是最好就是什么 claim 都不要来给我。你像这样的话，会不会比较了解一点？
比较了解，可是我想再澄清一下，你的 Advantage Plan 是不是就是你刚刚 refer 那个？Plan F，
no， 那个是 supplement， 那个就叫 Medicare。
那你在这个 Advantage Plan 里面，你自己可以再挑 HMO、PPO 跟那个。
对，但是tricky 的地方就是你全部记得 ，Advantage 有的是 zero， 今年只有一家是不要钱，就是 United Health， 但是有的要钱的话，比如说 SunPass 只有28块都很便宜，可是基本上你如果去看 PPO 的话。不管哪一个公司 ，Humana 也好 ，Region 也好，不是很多公司。你要记得，因为你是住在 Washington State， 你要买 Washington State。如果你说，我朋友在 New Jersey， 那不一样，因为你记不记得这个Advantage 必须要在它 located 的地方，你住的地区，它有没有 cover 你的 county？ 所以 PPO 都是要钱的 ，OK？ 这个你只要记得我今天这样跟你讲 ，PPO 一定要钱 ，Matter 是多少钱？今年的 Region 是1个月99块钱 ，OK？ 但是不是说钱的问题，你还要看你里面的内容，你要看你的医生，好，还有就是你每次花的 copay 啦，医院的 out of pocket 这些都会 ，Rick 他等一下会 continue 讲，好。
那如果说我没有 qualify anything yet，OK，but 我如果说参加 Plan C 的话 ，I don't need to sign up for A or B or D。
你要参加这些所有什么 Plan， 第一件事你一定要有 A 跟 B， 因为在申请单上面就是要问你有没有这 A、B 卡 ，OK？ 你如果没有 A、B 卡，你什么都买不到。
你要 qualify Medicare。
但是有的人 ，OK， 有的人确实 case 是这样子。他是已经超过60岁，可是他跟着他的 spouse 在 group plan， 所以他没有去参加 Part B， 因为你一参加 Part B， Social Security 1% 就要把你拿，今年是99块，去年是101，所以有的人他说，哎，我才不愿意花那个钱啊。我为什么？因为我一上 Part B， 我就是要先有 B 嘛，因为你要有 A 跟 B， 你才可以去找这些 supplement， 找 F plan 也好，找 Advantage plan， 是不是？
所以 A 不用付钱 ，B 要付钱。
这个也不对，你要做 earn， 你要 earn 就是你要做10年，
我知道有
40，但是很多新移民来，他没有 earn， 那就没有。好，
我在问你
对的，呀。Okay, so now the picture. And yeah, he understands Chinese too. 英国人的幽默不一样，英国人的幽默。
请问一下啊，参加那个帕西啊，那个费用比分别今天把它差多少？差不多差多少
？What do you mean？ 你就这样讲好了。My Advantage Plan 呢，你如果说比较希望弹性大一点，那你就要走 PPO 的 plan。那像我刚刚说 Region 大家都听过嘛，哈 ，Region 听过，而且它的网站还有它的那个药的那个 formula 也很不错。它今年要最便宜的，它只有2个 plan， 就是99。那 Humana 你们大概听，因为你要记得 Washington State available 的 plan，PPO 也不是很多家公司，所以 Humana is a
it is $69.
69块钱。但是学历的地方，今天我们没有办法讲 comparison， 所以我的意思就是说，你要注意你的医生，还有你的 copay， 还有你的 out of pocket， 这个 Rick 等一下都会纲要先提出来，所以让你们以后就是说，你今天走出去之后，你知道说，哦，我现在知道了 ，F 不是占 Advantage。OK， 要花钱，但是有的人他不希望有账单来的话，来，最好不要生病，对啊，没错。
对，不要生病。可以给瑞克回答，也可以给你回答。Rick, may I ask you a question?
Yes,
Thanks to the basic. Here, I'm a housewife. I can never work one day outside my family. That means I don't earn any Medicare at all. I'm not qualified for that.
Are you?
If I'm a housewife all my life,
Yes.
and I have never worked outside my family,
Yes.
so I'm not qualified. Is that all?
No, actually, you can qualify through your spouse.
How about if my spouse live in Taiwan or is not?
Oh, so he's not eligible.
Then
So
you're
I
right.
have the qualification problem.
You are in trouble.
That's my question too.
No, it's a good question. You
No, he is he knows.
So, okay, the question is, I'm not qualified at all, right?
you would need to actually pay for it yourself, sir.
Okay, if I want to buy.
If you want to buy it,
Part A, not qualified at all?
you would need to buy
Buy
it,
it.
and you're right.
Yeah.
Yes.
Good, that's my question, thank you.
You're very welcome. You're very welcome. Okay.
那个下课，你可以私下问我，因为有的人哈，我有很多客人他是蜻蜓点，就是候鸟，所以来这里是不是值不值得买 AB？ 我会给你一个 answer。
因为事实上这种情况在我们台湾人社团非常多。
但是我也有客人他是earn了，但是他又很少来，所以也
刚好相反。
刚好，然后他是不是需要 supplement？ 是需要，因为有时候来的时候，就是因为 Medicare 不够嘛，来，所以这个我也有 answer。但是今天我们
建议你多参加英文这个演讲就行。我要解释一下，因为很多人在问我，我是不是 qualify Medicare？ 这是很多人啊，只要你跟你的先生或是你的太太，假如他们之中有一位工作10年，虽然你已经超过65岁了。你的先生或你太太在工作的还没有65岁，还没有 claim Social Security， 你有资格。甚至你假如离婚的话也可以啊，只要结婚10年，你的 spouse 工作10年他虽然没有 claim 那个 Social Security，
你还是可以 claim Medicare， 但是不能 claim Social Security。Social Security 跟 Medicare 是不同 ，Social Security 要等到那位你的 spouse 开始领的时候你才能领，这不同的地方。Medicare 是可以 ，OK， 这样很清楚吧？这个 qualification， 不管你住在什么地方，你可以都可以。还有一些
雷先生，我补充一点，因为这个是我一个 client 的 case， 他先生很早就走了。但是因为他先生确实是有做够10年，他没做事就好像你没做事，他是外。但是他不能马上拿 Medicare， 他也要等到他65岁。可是他在62岁的时候，他就去 qualify 拿 Social Security。OK， 所以62、66，这是2个拿 Social Security， 现在没有65岁了，66岁了哈。那 Medicare 是要到65岁，所以你的 deceased spouse 如果 qualify， 你也要等到65岁。
要考量 ，Social Security 跟 Medicare 是不同的地方，我们要了解。
在这个情况下，就是说太太还在工作，那要是说先生 qualify， 就是 over 65，
可以。
而且要做什么吗？
那个问题等一下我跟你讲。老师要赶快讲完。
对，但这个讲完了后面再分析比较，有很多很重要。就有人问我，我常常在台湾、美国这样，我是不是要买什么比较便宜的？等一下他会讲，因为这个问题我就不大晓得，哪一个你可能你不知道使用到的。他会告诉你买哪一个比较便宜，但是我告诉他说不要简单的，不要说哪一个 product 比较好，但是他可以告诉有一种你甚至不要交钱的，就是刚才所说的 HMO 的那个，还有刚才有那个5项的，你们要注意，他现在讲的是 Medicare， 不是你还在工作的那个私人的所以这个不要搞乱。所以我今天就是请他们来讲，有时候这个很复杂，就是可能会不晓得。这个是我们今天在讲的，只是在讲 Medicare， 不是在讲 private 的那个你这个还在工作的不要把那个问题拿出来，大家都很亏啊。
好，那个老师讲完了。有一部分他本来有个 flag， 那个什么图片呢，是教你怎么样比较，就好像你说，我今天是要买 Advantage 比较好，是买 Medicare 比较好。图片找不到。没关系，他现在在找。所以呢，我们现在提问题因为2个小时。
我可以讲一些了我要讲一些因为这个HMO 呢是中国传统的，最早从中国开始大概5、6千年前，中国人是拿东西给医师说你帮我照顾，让我健康那时候是鸡啦、鸭啦这样后来差不多20年前，美国开始引用这个观念，就是说你定期付给这个保险公司，就是联邦把钱付给保险公司，但是这些保险公司就是负责照顾这一批人，你好好的健康，好好的生活，那保持健康，然后他给你医疗方面都给你照顾，这个 HMO 嘛，所以这样的关系呢，联邦就是把这一笔钱，它有统计数字嘛，一个人1个月大概要花多少钱？这些钱他拿到一部分是联邦自己要行政要用的，然后剩下这些钱交给这些保险公司，说你好好的照顾这些人。这当然这些资源，他只有说1个月大概400块的话，他一定要掌控这些开销嘛，所以他会注意说你哪里该用，哪里不该用，这样这是 Medicare 的，那 PPO 的话是说你还是很自由，但是只要有这些医师愿意跟这个保险公司 contract 就可以，所以那个比较自由了。那比较自由的关系，他的那个资源可能会超过他的掌控，你说你要做这个检查，做什么什么，那么可能超过的开销，那么这个只是要大家共同。
对，所以陈医生你说的意思说，每一次看病的话，要经过他们同意才可以开销这个。
对，所以他说你要有一个家庭医师，结果要有一个家庭医师，就是说这个家庭医师直接对这个保险公司在掌控这些照顾的方式。那么如果说有特别的开销、特别的检查，那么保险公司那边要给你看一下说是不是为什么要做，那这样大部分都是没问题的，只是手续比较麻烦。那么如果说到最后什么好几个 plan 那个呢，medical service account 那个意思就是说，
大家安静。
请大家安静。
Medical savings 那个呢，就是说我这笔钱，联邦这笔钱呢，我自己要存在哪里，我决定要用不要用。好，那么这样的话呢，他说我要看这个医生呢，我要跟他讲，我看一次只有5块钱，同不同意？好，这样他来节省开销，但是这个钱变成你自己可以保留了。好，但是这个现在不可行了。好，所以他们这里没有。好，这样，所以说 HMO 是说，你把联邦把钱给这个 group 的保险公司，好好的照顾这一批人，这样。那么这样的关系，你不用再付什么钱，只有每一次去看的 co-payment， 其他大概不用付什么钱。但是因为它限制在这个范围，所以它要掌控。好，那么如果说你认为你要比较自由啊，我随时到哪一周都要去看什么病啊，哈，那么你这个就不太适合。如果说半年住在西雅图，半年住在纽约西，然后到处跑的话，这个 plan 就不适合。因为你要用到这个 Medicare 的话，就是说你要到急诊室去，它证明这个是 urgent， 这样才有用，不然一般它不太高。好，
适合本州的
啊，
适合住在本州。
对，适合在 local 的话就很适合。哦，因为大概病都是需要这样控制就好了，不需要特别。哦，只是有一些人他特别很紧张的，需要很多特别检查，但是这保险公司不行，你要我们去 check 一下到底为什么有算。好，大概是这样。那 Ppl 的话就自由一点。好，大概就这样而已。那其实都很简单的。
好，老师回来了，找到图片了，找到图片了。OK， 等一下那个问题我会跟你。
All right, a couple of things I just want to mention as we're going through this. So the information that I just shared with you, I know that it has or had a logo on it from United Healthcare, but it has absolutely nothing to do with why we're here this morning. We are here to share some very general information about the options that you have and the way that the Medicare program works. It just so happens that I use that presentation because they have the best format for us to use to help people understand how that works. So please don't feel uncomfortable. I hope you don't feel uncomfortable or you feel as if we are promoting a specific company, because we're not. What we're trying to do is make sure that you understand that Ann is available to help you with helping you make a decision about the choices that are available, because there are lots of choices available. I use that information because that company happens to have the best slide presentation that I found to help you understand some things.
By the way, the pen given to you is the United Health.
That is. That's from United Healthcare.
But we just feel the pen is everybody needs a pen. Don't think that we are promoting United Health.
We're not. What we're trying to do is make sure that that everybody has enough information to be really dangerous. Okay, you've got enough information that you understand how to make a really well-informed decision. Okay, and some of the other things that we kind of talk about as well with people, I know that we've kind of been talking about this as we've been going along, is trying to think about what things to think about when you're enrolling or thinking about choosing a plan. You know, if you look at some of the programs, they're going to have something called a maximum out-of-pocket. You know, what that means is how much money do I have to spend, or would I spend, before my policy pays for everything at 100%. And if you look at the different companies, they all vary. You know, some of them used to be about $2,900. Now some of them are about $5,700. Maximum out of pocket, what that is a combination of all of the co-payments that you make for your doctor's visits and for hospital care and for anything that you pay with the exception of your prescription drugs. It's anything medical. Any medical expenses that you pay for. If sometime during the year, if you had lots and lots of healthcare expenses and the co-payments and the co-insurance that you pay reach that level, that $5,700 or the $3,400, whatever the company has set at their maximum out-of-pocket, then the policy will pay 100% of your expenses for the rest of the calendar year. The thing to remember, and the reason I continue to kind of come back to this gentleman, is that if you have the original Medicare program, Part A and B by itself, Medicare does not have a maximum out-of-pocket. Medicare Advantage plans do. So it's the way to make sure that you know how much you're limited to spending in some way. There's a stop loss point at that, okay? I know that the doctor was talking about managed care programs, a primary care physician. So, you know, if you are thinking about enrolling in a Medicare Advantage plan, and it is an HMO type plan, right? That means that you do have to use a primary care physician. So sometimes people are a little nervous about that. But I think the other thing is, if you find that your doctor is a part of the program that you are looking at, then they're going to continue to look after you, okay? You now have a policy that's going to help pay for your expenses. That doctor's going to continue to make sure they make the referrals and recommendations for you. So that's something to make sure that you keep in mind. So whatever company that you're thinking about using, find out if your doctor is a part of that health plan, okay? And again, Ann can help you with that. She's got a list of all of the physicians with all of the different programs as well. And make sure you check your doctors on the program as well. Make sure that if you're using what they call a specialist, so the distinction about that is a specialist is someone who is a dermatologist, a cardiologist, a urologist, any of those types of doctors compared to a general physician, a general internist, you know, a family practitioner. All of those types of doctors are what they consider a primary care physician. But again, if you are using a number of doctors, you have more than one healthcare provider, make sure that you check the list to find out if your doctors are on that program, so you feel comfortable knowing that you're going to continue receiving the care that you have been under the plan that you're looking at. Is that good information? Yeah? You know, hospital care, the thing that you're going to look at in any of these programs, we were kind of talking about that earlier. The companies, because they all receive the same money to manage the plans that you're enrolling in, they sometimes will change how they operate. Some companies may say that you're responsible for a certain amount of money, $390 for the first 4 days of your stay, and then on the 5th day, they then pay 100% of everything. Some companies may say they're going to pay $275 for 8 days, and then on the 9th day is when they begin to pay 100%. So the thing is, most of us, of course, again, aren't necessarily going to be in a situation where we're in the hospital, but you want to make sure that you've got coverage that's going to help you in that situation as well. So it really depends on how comfortable you feel about what you're paying for as well. How does it fit my budget? You know, can I make sure that if this does happen, I can pay for that service? And that's something that you need to make sure that you look at as well. The companies are also going to tell you what they're going to pay for, you know, things like outpatient surgery or CAT scans. Some companies are going to, when you look at them, they're going to tell you that you're responsible for 20% of the cost of an MRI or a CAT scan. Some companies may have a fixed co-payment, $250 for that. Regardless, both of those amounts that you pay for your outpatient surgery or CAT scans or hospital care or any of those things, anytime you pay for any of these services, all of those costs are going towards this maximum out-of-pocket. Most people never reach this amount, but it's a way to know that if something really, really bad does happen, that there's a limited amount of money that you are going to have to spend to continue to make sure that you're being looked after as well. About 2 years ago, the federal government said that they wanted to try and rate the companies. They call it a star rating. So here in Washington State, we have one of about 8 companies in the entire country that has a 5-star rating. Does anybody know which company that is? Does anybody know?
Group Health.
See that gentleman in the back? Give him a great big prize.
Who's that?
What was the name?
Group Health.
Group Health. Group health.
I told him.
Well, that's why he knows. That's why he knows. So, group health. Group health is one of the other programs that Ann works with, and if you are interested in that program, she can help you with that information as well. Group health has a 5-star rating. That means that throughout the entire year, if someone were to want to switch to that program, or they, as far as the federal government are concerned, have very high customer service standards. They have very high standards for the way that they manage their program as well. And it's a really great recognition. You know, all of the other programs have star ratings anywhere from about a 3, 3.5 to a 4, which means that they're definitely meeting all of the requirements from financial standpoints, making sure that people answer the phone if you call them, yeah, customer service. But you know, remember that Ann is here to help you guide through that as well and help answer your questions for you.
I don't want the best one. I want the worst one.
You want the worst one?
Avoid.
Okay. You want to know which one to avoid?
Yeah.
We don't work with that plan. We don't work with that plan. We're going to avoid that for you.
So the 5-star is only for what? So only 1 year for how many years?
Every year. That's a good question. How many times when do they rate the plans? The companies are rated every single year. And so for the year, they now have this big recognition of being a 5-star plan. Group health, actually, this is the second year. This is the second year in succession that they have a 5-star rating. But every single year, as the federal government collects all of the information to help them with that rating, they then send out the information, and that's the rating that you have for the year. So this is their second year. And every year that may change and vary.
So this
as
is
well.
a group health. But group health doesn't have Medicare stuff. This one is the HMO, Advantage. Okay. But they are 5-star. Okay. So that's a good company. But doesn't mean good company is doctor. Your doctor will be there. Most Chinese doctors not there. So, but one thing, group health is one thing. If you don't speak English, they will find interpreter. 他们会找翻译的给你。所以呢，有的人就是他觉得系统好，他可以跟。
So the 5-star is based only on HMO or all 5 of them? HMO, Ppl, all 5 of them?
Any Medicare Advantage program.
Right.
Any Medicare Advantage program. The question was, does the star rating only apply to HMO plans? And actually, the star rating applies to any Medicare Advantage plan. So remember, when we were looking at the different types of Medicare Advantage plans, the PPOs, the special needs plan, and those other things, they also have a rating as well. And so you can always find that out. Whenever you receive any information from the company, they have to make sure that they send you a summary of the benefits, information about the star rating, the enrollment application, and that way then you can begin to make a determination about the type of program that you use.
Is there a website you can go in and evaluate yourself and say, put your choices and then evaluate which one will be the best for you?
Yeah, it's right there.
No, I say
I know, I know, I was just joking. Okay, so the question is, the question is there anywhere is there a website that you can go to make a comparison or evaluate the plans? So one thing to remember is, how many of you, let me ask you a question here, how many of you have received this booklet this year? The Medicare and You booklet. You may have received this, and if you haven't, you can go to like your library, your local Social Security office should have copies of this as well. In the back of this booklet, there is information about all of the companies, the Medicare Advantage plans, the supplements, the prescription Part D programs available in Washington State. If you have access to the internet, whether it's here or through at home or somewhere else, if you log on to Medicare.gov, www.medicare.gov, there is a way that you can make a comparison of the different plans available by your zip code. And up to about 3 different companies you can look at. You type in your zip code, and you have to kind of go through some steps, but it will allow you to compare like up to about 3 different companies, and then you can begin to help that as well. One of the things to remember also, if you're doing that and you're still kind of confused about that as well, you know, take the time to contact Ann, make sure that you fill out a scope of appointment, and then she can help you compare all of that information also. You know, the things that we've kind of talked about that you're going to look at is the premiums. I know that sometimes some companies are trying really hard to help you think that the best thing for you is to pay no monthly premium, right? It's a choice. Some people say, how do you do that? You know, what's the catch? How can I not pay a premium? Remember, these companies are all being paid by the federal government. That's how they make sure that they offer you all of the Medicare benefits. Some of them have found a way to market the plan to you so that you don't have to pay an additional premium other than your Medicare premium. Some of them do have a monthly premium, okay? It doesn't mean that they're better or worse. It just means that that company has figured out that that's what they have to do and can do with their money. So from your standpoint, you need to sit down at home and look at your budget, okay? Make sure that whatever plan you're enrolling in fits your budget, has your doctors, that the prescriptions that you are looking at are included. If you use a certain pharmacy, that's a part of it as well. Any and all of those things you need to make sure that you look at. Will my plan have a deductible? Does everybody know what a deductible is? Yeah? You have car insurance. Does everybody have car insurance? Yes, if you drive, you have to have car insurance, right? But your insurance policy normally has an amount that you pay before they pay, right? That's what a deductible is. Well, the original Medicare program does have a deductible.
Yes.
Yes. Medicare Advantage plans many times do not have deductibles. Sometimes they do. Some programs do. But most of them do not. They've absorbed that amount in, and so you don't have that additional deductible. It just means that when you begin the year, you may be responsible for a certain amount of money. It may also be a part of your prescription drug program. Some of the prescription drug plans with your Medicare Advantage plan may have a deductible. Some plans have made sure that they hide that deductible so that you don't have to pay it. The only thing that you have to do is make co-payments for your prescriptions, your generic drugs and your brand name drugs. So that's something else to take into consideration as well. Sometimes people may have help. Does everybody understand the prescription drug program? Kind of. Yeah. So remember, the way that the federal government designed the program, and I wish that I had a diagram for this, but the way that they designed it is that at the beginning of every year, everyone has a set amount of money that you're going to use for your prescription drugs. And in 2013, that amount is going to be $2,970, okay? Whether you're enrolled in a Medicare Advantage program, whichever one it is, or if you have a separate prescription drug program, the amount that you have is $2,970. And the way that it works, yeah.
2970，他现在在跟你讲，就是说，因为没有图片嘛，哈，你就记得这个数目字。你如果在2970以下，这个就是 government 2013年给你的 budget， 不管你是在 Medicare， 所以在这个里面 Advantage 它关于它可能有什么 copay 啊，每家公司不一样，但是2970，记得这个数目字。
那如果没有买Part B的人，那个钱到哪里去？没有买Part B。
Wait, he said if somebody didn't apply Part B, where that $2,970 go? The gentleman asked.
Where does it go?
Yeah.
It doesn't go anywhere. I'm going to answer your question in just a moment because it's good. This gentleman just asked a question about the prescription drug program. you know, where if you don't have a Part D plan,
No, if you have a,
if
you don't have a Part D.
if you don't have a Part D plan, then this doesn't really apply to you because you have to pay for your prescription drugs 100%.
Right.
Yeah. If you do have a Part D plan, whether it's a part of your managed care program or if you purchased it separately, just a separate Part D program, everybody at the beginning of each year, January the 1st, will have about $2,970 to put towards the cost of their drugs, okay? And the way that the companies design this is that they have you make a co-payment. You pay an amount, $5, $10, $50 for your generic and your brand name drugs, okay? Whatever amount that you pay and whatever amount that the company pays towards that is subtracted from that $2,970. So if the cost of the medication was $20 and you pay $5 and the company pays $15, they are going to subtract $20 from that $2,970. Is everybody following me?
Yeah.
Okay. If you're the person who doesn't take a lot of medication, then you're going to find that that $2,900 is going to help you for the entire year. Yes?
听得懂吗?
Yeah.
If you are the person who takes many drugs,
Yes.
that $2,900 is not going to last for very long, is it?
Right.
No. When you run out of money, the thing that happens is you now are in what they call the coverage gap, or the donut hole. Have you ever heard of that term before?
Yes. Donut hole.
Donut hole. What does it mean? It means that you now become 100% responsible for the cost of all of your medications until you spend $4,700. Okay?
4700啊，2013 2970到4700这一段，中间自己要
So
自己
probably
那有没有人？
$1,800 you have to
没有
pay
人
the all
是
100%.
，pay
有很多
100%.
人 ，OK？
Okay, so you pay 100%. It's not 100% because the federal government now give you discounts during that time. They're going to discount your brand name drugs by 50%, and they're going to discount your generic drugs by 16, I believe it's 16% this year, 14%, so 79%. 14% for your generic drugs, 50% for your brand name drugs during that time. But everything has to come out of your pocket until you reach $4,700 total. When you reach that number, then the federal government will begin to pay 95% of your medications until December the 31st. Some people may qualify for what they call extra help for your prescription drugs. So if you don't know whether you qualify for it, and sometimes it's because it's a financial qualification, but if you do qualify, then there is no coverage gap for your specific prescription drug program. But again, that's something that you can talk to Ann about, or you can also talk to Social Security and they will be able to help you make sure that you understand that, okay? So if you have a prescription drug program, it's a great way to make sure that it looks after you. Sometimes people, and I've spoken to many people who say, I don't take prescription drugs, okay? Why do I want to buy a prescription drug program, right? Which is true. Well, of course, you never know when you may possibly have to have a prescription drug program. If you are the person who has decided not to enroll in a prescription drug program, and then at some later date you do enroll in a prescription drug program, the federal government will penalize you. There will be a penalty. They will charge you about 1% of the cost of prescription drug programs nationwide, which about this year is about $40 a month. They charge you 1%, okay, of that amount for the length of time that you were not enrolled in a prescription drug program. They'll get you. They're going to get you. Yes, sir.
Does this cover cancer therapy, chemotherapy?
The question is, does your prescription Part D plan cover chemotherapy drugs? And the answer to that question is no. Your chemotherapy drugs are covered under your medical benefits with Medicare, Part B. Okay? Part B. So, which brings up an excellent point, because if someone were diagnosed with a form of cancer and they were receiving chemotherapy drugs, the cost for that normally under most of these programs is about 20% of the cost of whatever the medication is. And of course we know that's very, very expensive, right? But one thing to remember, we were talking about a maximum out-of-pocket. Remember that? The maximum amount that you spend. If someone were to find themselves in a situation where they were diagnosed with cancer, they were receiving chemotherapy drugs, and they had to pay for those things, if you're enrolled in one of these programs that have a maximum out-of-pocket, at some point in time very early, you may spend enough to reach that maximum out-of-pocket. And the nice thing about that is it's going to help you know that going forward, you'll continue to receive care, and everything will then be paid for at 100%. So thank you very much for bringing that up.
So, sorry. You know, the maximum out-of-pocket, is that including right now the difference between 4,700 versus 2,900?
No, sir. And thank you very much for bringing that up. The gentleman was just saying, what about that maximum out-of-pocket and then the prescription drug thing that you were talking about? One thing to remember is your prescription drug program is always going to be separate and not included in the maximum out-of-pocket. The maximum out-of-pocket is just specifically for any of the medical services that you have, okay? Including chemotherapy drugs, which is covered under your medical benefits. Your Part D prescription drug program is completely separate from that and has that separate schedule as well.
Okay, 我跟大家补充一下，他刚 Can you go back the out-of-pocket? 因为Medicare SUS 就是我们讲的 Medicare， 它没有什么 deductible。在这边有 Advantage 最大的不同的地方，它是有一个 out-of-pocket。刚刚他不是有提到一个 out-of-pocket， 有的公司是3400，有的公司5700。所以呢，你们在选择 plan 的时候就说，zero premium， 它不见得它的 out-of-pocket 会比别人便宜，就比较低。但是呢，这个最大的 Advantage 呢，它所有的 copay 跟那个有的地方它必须要付20% Medicare Approved， 像比如说我去做 MRI， 也许这3000块在 United Health， 我还要自己付20%， 3000块的20% 多少钱 ？OK， 这个600块就会跑到你的 out of pocket。每一次你去看门诊，你的 copay 10块也好，40块也好，也会跑到你的 out of pocket。这个 out of pocket 一达到之后，那他的刚刚在讲跟你讲，就是说一个健康的人很难去达到那个3400也好，5700也好，但是就是让你有一个 vision， 就是说啊，我最多就是到这个程度，我下一次以后我今年，因为他这个是1月一直到12月，那你就不需要担心。但是 Medicare SUP 的人呢，他虽然是没有什么 deductible， 他是去保你那个20%。可是他一个月搞不好要交170几块钱，然后他还要再买一个 prescription， 他等于要一个月要花200多块钱。所以有很多人常常来问我，他说我身体很健康，我一年要花2-3千块钱，是不是值得？那我买 zero premium， 我不要花钱，我顶多一次生病花个10块钱，这样子，那这个是每一个人的 choice。那你如果搞不清楚，我也跟你讲，就是说后面也有 comparison， 但是有时候真的讲起来，不见得大家都看得懂。所以呢，你们如果真的有问题，我是有跟雷先生讲，我每个礼拜4下午茶的时候，我除了我自己会做一些糕点来让大家分享，因为这个是我的兴趣。你们有问题可以带着你们的问题，因为每一个人吃的药也不一样，看的医生也不一样。所以这个是我可以提供，帮你们大家做这个。但是 out of pocket 跟个人的 individual 不一样，就是说你所有东西都会跑到，不管是做什么，但是药那个2700啊什么2970、4700，这个是不在你的 out of pocket 里面，分开来的。
那这样子说，你那个 out of pocket 有没有包括 hospital 的部分？
你记不记得他是把你的 A 跟 B 跟 D combine？
对嘛 ，D 没有包嘛。
对所以他刚刚在跟你讲的时候 ，hospital 有的公司，他一天可能是收你340的 copay， 那他也许5天 maximum， 你第6天住院以后你什么都不用付，所以那个几百块都也会跑到你的 out of pocket。Private 也很多人可能3块这种。
That's about it.
Yeah.
去年你们来讲的时候，我给你一个功课回去做，这个都没有做。
因为我们的能力有时候不见得那个能力。
我的意思就是说，我们这里提供医学演讲很多活动，是符合 Medicare 的宗旨，就是要保持健康，少用这些医疗资源。那我们教育很多东西，就是说不必要的检查、不必要的开销、不必要的治疗，我们都可以消减掉。那么我们要求你们回去跟你们那边的 Medicare Company 讲，把银发族基金会的活动啊这些纳入你们的规范里面，那可以建议你们的所有的 sign up 的 member 来参与这些活动，包括教育啊、训练啊这些呢，应该是可以减少他们使用医疗资源的。所以呢，我们一直希望说你们这个回去真正的做这个功课。
我们今天有。United Health 有来，对不对？那个美丽的小姐有来照相，她照相不是来照相，她是希望把这些反映到。
对，我是说，不是只有照相没有用，
那
放进去可以等半天。
不是，我的 point。
我们等了1年了，所以我的意思就是说，回去一定要做这个功课。我们大家这么努力来听你们演讲的目的，就是说希望健康一点、快乐一点，而且不必要做不必要的治疗，这样才能够做了，所以希望你们今天回去努力做这件事。
Our homework is trying to help manage, negotiate, like Dr. Chen told. Our mission is here, but we will do the best we can because we are just in here. You know there are how many levels, but as me, I'm working 20 years. 我是在我的100%大部分都在 Asia， 所以我尽量能够把我们想要知道的，还有就是我们需要的，当然我会提到保险公司，所以我今天才会把 United Health 的那个公司的代表带来的原因，就是说，但是有时候不是我一个人的能力，因为比如说你说这个公司它也许是nationwide的，它可能还要考虑很多的条件，但是我们尽量。我有开始的，我真的是有在开始。OK，今天我们谢谢这个